I just want to ask you about this news this morning, and I think it's going to be announced by the Prime Minister in about half an hour's time or so. But those repatriation flights to resume next week, that's despite record numbers in India, another 412,000 positive cases. Are you concerned about leakage from quarantine facilities? Because it seems inevitable that positive infection rates in quarantine is going to exceed 2%.
Well, Peter, the reason the decision was taken was because we had 54 cases in Howard Springs. That number's just about halved, and we're advised will be down to zero by the 15th of May. Now, based on medical advice, we will resume those flights if that's what the medical advice says we are able to do. But it will be done with the advice as to how we can ensure that those returning Australians are COVID-free. So there'll be testing put in place. We want to do this carefully and cautiously to make sure that the Howard Springs facility can deal with the returnees, and we don't see numbers of cases increase to the extent that we did where there were 54 cases in Howard Springs, because our medical facilities here in Australia have to be able to deal with the returnees if they have COVID.
It stands to reason though, doesn't it, that those positive numbers will jack up pretty quickly as soon as you resume those flights?
Oh no, look, we'll take the medical advice on this in terms of the testing regimes that we have to put in place before people get on flights. And you can put in place procedures where 2 tests have to be undertaken before you hop on a flight, so that we can make sure we're doing everything we can to limit the amount of COVID cases who are returning on those flights.
Would you be leaning on states to increase their travel caps?
Look, that'll be part of the discussions that the Prime Minister will be having with state and territory leaders at National Cabinet. So they're the discussions that are had at National Cabinet. What we've been focused on is the 2-week temporary ban that was put in place and how we can resume that, but resume it in a way which is safe and we know which will protect Australians and protect the health circumstances that we've seen across the globe with this third wave of the pandemic.
So just for now, it will be 1 flight a week?
Look, those details will be announced by the Prime Minister today. As I've said, all this will be based on the expert medical advice, and at the moment the planning is being put in place as to what those flights should look like, how frequent they will be, but it'll all be dependent on that expert medical advice. That's how we've got ourselves through this pandemic so successfully, is by listening and taking on board that expert medical advice, and that's what we'll continue to do.
You must be worried about those numbers though, because they are higher now than what they were when the ban was originally put in place.
Look, we'll take a very cautious approach. There's no question about that, and based on that expert medical advice, if they say the flights can resume, then the flights will resume, but we'll do so in a way that we know is keeping Australians safe. And that's why all the planning is taking place at the moment. That's why we're looking at what needs to be done with regards to testing of people before they get on the flights, and how you can arrange to have 2 tests undertaken before people get on the flight. So all those things are under active consideration and being worked through at the moment.
And who do you decide gets priority?
Well, there are roughly 900 vulnerable Australians in India at the moment. The High Commissioner and our Consul Generals across India are obviously in contact with those vulnerable Australians, and they'll work through the situations and they'll be able to advise as to who needs to get on the flight. So this has been done, the planning has already been undertaken, and we'll continue to work with those vulnerable Australians to see how we can repatriate them if the medical advice says the flight should resume on 15 May.